Hello, everybody. Thank you for being here to talk about trans folks and cancer disparities. I'm Michael Munson with Forge. I'm part of a team of folks who have worked together on this project for quite a long time. You'll be hearing from many of us tonight. Just wanted to start off with a couple of bits of housekeeping so that we all are kind of in the know of what our landscape is tonight. Right now, everybody is on listen only mode if you're a participant. So we encourage you to engage in the chat. Encourage you to engage a lot in the chat as we go along tonight. So we'd like to have your input as well as your thoughts about what's going on tonight. We're recording the session, as many of you probably heard when you logged in, so that we can capture what you're saying and capture this so that other people can listen to it later. We have ASL for the evening, and Caleb, who's on Forge's staff, will be making sure that ASL is pinned and the primary speaker is pinned so that you can see both the speaker, ASL, and the slides. If you would like to send any confidential messages that you'd like us to share out, Caleb is the person to send a private message to, and he will make sure that we share that out if you'd like it to be shared and not have your name associated with any things. Before we get going into the content of tonight, I wanted to make sure that we acknowledge the current moment that we're in. We're living in some really tough times. Some of us that have been doing trans work for 20 years or 30 years or 40 years, which is kind of like me, have never witnessed this much pervasive anti-trans sentiment or cruelty. And even though you might not be directly connected to trans communities, or if you are, the anti-trans hatred that's happening right now, the legislation that's happening, is all around us, and it's really impossible for any of us to kind of avoid being affected by what's happening in this present moment. And as we talk tonight, we also recognize that trans people are people. Trans people have bodies. Trans people still get cancer, and trans people still need preventive screening. So we want to acknowledge both the current reality of what's happening that's harmful, and also that we need to keep on making sure that we address the barriers that are happening in healthcare and everywhere else so that trans people can have better access to the world and medicine and all of the things that every person is entitled to and should be afforded. So our agenda for the night, let me just share with you a little bit of an overview. I'm going to share with you a little bit who our team is. We will then talk a little bit about what and why this is timely. We'll talk about our goals for what we're going to spend the majority of time on tonight, a little bit about our process, and then we'll have some time for discussion about possible solutions and really wanting to get your feedback, and then we'll wrap up with some next steps. So our goal in this project was to create recommendations to address cancer disparities in the trans and non-binary population, which reflect the perspectives and interest of the community, clinicians, and researchers. We had 16 of us that were on our semi-large team, and 7 of us who kind of took the guiding role, leadership in big quotes, to kind of help shepherd things along. So the folks that were kind of in that leadership guiding role were from the Medical College of Wisconsin, the Community and Cancer Science Network, Evaluation Plus, and Forge. So we've got Chandler and me and Andy and Melinda and Toby and Laura and Caleb. The rest of our team were folks that were from trans communities, folks that were private care or primary care physicians, people that were researchers. So we had a good group of folks that really represented a lot of different diversity of experiences and perspectives and histories and identities. So the folks that were part of that larger team are Christina, Camden, Danira, Annie, Gwen, Emmett, Shannon, Steve, and Stu. So we are all glad to be here with you tonight, and I'm going to turn things over to Chandler to take us to the next pieces.
Thanks, Michael. So just to give everyone a little bit of background this evening of how we sort of started off thinking about our work, is that we know that there is increasing data showing that the number of recorded individuals reporting themselves as being transgender, non-binary here in America is growing. And there's also national data showing an increasing use of gender affirming therapies over time. And whenever we specifically look at the population who report that they identify as trans, non-binary, and gender diverse, we see this primarily in individuals under the age of 30. And we think this is a really important topic because cancer is typically seen in individuals over 40 or 50 years of age. And so as this population ages, it's going to be really important for us to have this data about how to screen and manage cancer in this population over the next few decades. And here you can just see some graphical representation of the increasing amount of gender affirming operations performed across the US up until 2020, whenever COVID happened. So there is data showing there's significant differences in cancer screening and cancer survival amongst the trans and gender diverse population. If we go ahead and advance the slide, so this was a recent study that was done by our group, specifically looking at breast cancer amongst trans population and breast cancer in the cisgender population. And whenever we match patients based on age, type of breast cancer, age diagnosis, year of diagnosis, we can see here that at 5 years, there's a significant 8% overall survival disparity, with the trans population having a worse survival with breast cancer compared to the cisgender population. So indicating that noticeable differences and noticeable disparities definitely exist. So in addition to improving gender data collection, a comprehensive understanding for us is really to guide clinically and socially relevant research questions, specifically around cancer risk in the transgender, non-binary, and gender diverse population, cancer screening and early detection, cancer treatment, as well as survivorship. And I'm going to go ahead and turn things over to Toby and Laura, who's going to talk a little bit more about our process.
Hey everyone, thanks for being here. So our process was involved bringing together diverse audiences, so community members, clinicians, and researchers to learn from each other and to engage others, develop solutions, and then gather with all of you. This is done through the Community and Cancer Science Network, or CCSN. We have our framework here. We are guided by the 3 principles of deep equity, the integration of biology to policy perspectives, and we take a systems approach lens. This is just one project of many that actually spread across mostly the eastern part of Wisconsin, but going all the way north. It is one that engages, we have about 160 academic and community partners across the state, and multiple initiatives ranging from mammographic quality approaches to a curriculum that's held here at MCW that involves early career cellular biologists or clinical fellows and community members to learn together, as well as others. So it's a large program. We wanted you to know kind of where we sit, and that this is just one approach among many. And Laura is our evaluator, and I wanted to give her space to say anything if she would like here. Or are you good, Laura?
I think you covered a lot of it. It's just really exciting to have this be a part of the CCSN network, and help us refine our approach as we've been working through it over the last year.
Great. And if we go to the next slide, so we've actually been working together close to 2 years, and this will outline for everyone the approach we took. So in case you're wondering how we came to the potential solutions, our team learned from each other. We reviewed available data. We did something called a root cause analysis that you'll hear more about. We hosted discussion sessions. You'll also hear a little bit about that. And then we reviewed all of that information, and that you helped us propose and refine solutions. And now we're in that finalizing suggestions piece. So I think I'm going to be handing it over to Gwen, to talk about the root cause analysis.
Yeah, so before we go to the next slide, when we see health disparities like higher cancer risks or later diagnoses in transgender patients, it's really not enough just to respond to those outcomes. We need to understand why these disparities are happening in the first place, and that's where root cause analysis becomes a powerful tool. This means looking beyond the surface to uncover the deeper systemic issues that might contribute to a problem. It's not really about assigning blame to individuals. It's more about identifying patterns, gaps, or barriers in care that may be harming patients. And once we identify those root causes, we can work to change them, whether that's through training, system redesign, or advocacy, so that all patients, including those in the trans community, receive equitable care. It's a way of shifting from reacting to disparities to preventing them by changing the system, not just the symptom. So if we go to the next slide, this is super simple, right? So obviously by looking at the root cause analysis from our team, you see that it's crystal clear. That's a joke. It's obviously a very complex slide. And in all seriousness, this really just illustrates how big and complex this all is. And we don't expect you to be able to read or take all of it in right now. I want to walk you through a few key aspects. So if we advance the slide first, we have barriers that are related to system issues such as access to healthcare in terms of legislation or limited insurance. We also have misinformation and willful ignorance within the system. So if we go next and we focus in more at the individual level, we find mistrust really driving much of the response to avoiding care. And then in yet another theme around biological responses and genetics, we find various compounding life stressors. It was so important for us to engage the community directly to ground our root cause analysis in lived experiences and shared insights. And I will hand it over back to Michael.
Thank you. So we engaged with other folks and gathered new ideas, like Glenn was saying. So we wanted to have discussion sessions. We wanted to have input beyond our team of 16 people. So as we ideally reached out to people and said, hey, would you come and join our discussion groups? We found that a lot of times people were really busy because it's a busy world. And so we had kind of a combination of discussion sessions as well as one-on-one interactions with various folks because we wanted to have their input even if they couldn't attend a specific discussion session. So we had probably more community-oriented discussion sessions and then more one-on-one discussions with healthcare providers or researchers. So some of the discussion sessions that we held kind of two general kind of open call to the trans community to come and share with us their ideas and their thoughts. We held one discussion session for older trans folks because like Chandler was saying, you know, cancer shows up higher when folks are aging. We held one for trans folks of color, again, to kind of highlight some of the disparities that happen across race. We held one for parents of trans youth and kind of looking at how folks are accessing healthcare from a young age moving forward. And we held one that was for folks that had cancer or are currently living with cancer. And then again, we had those one-on-one conversations where we could really engage with both primary care providers as well as allied health professionals. And then we had conversations with researchers, and they were from three kind of main areas or main sectors. So laboratory science folks, clinical researchers, and population health researchers. So I'm going to just kind of remind us what Gwen just did. So you don't need to take into the slide. You can't take in the slide. It's way too small. But again, we kind of layered in those discussion sessions one on top of each other when we looked at that root cause. So we added those inputs in and it made a bigger mess, a bigger place for us to have discussions and a bigger place for us to find opportunities about what some of the solutions could be. So again, kind of layering in providers, layering in community, layering in researchers. So I'm going to flip things over to Laura, I believe.
Yep. flipping it over to me. So I'm going to talk a little bit about how we took all that mess and got to where we're here today. We engaged in a lot of interactive processes as a team over a period of several months, where we started to take all of that information that was gathered and started to just brainstorm ideas as a team. How might we respond to some of those factors that were identified in our root cause analysis? Once we had a long list of ideas generated, we started to organize and prioritize those ideas around common goals. How did they fit together? What was kind of the glue that held some of our ideas, whether it be screening or education, research, or what have you. And then once we had prioritized those goals, we engaged in some consensus building around what exactly is the goal or objective we want to achieve based on the ideas that were underneath it. Once we had narrowed that list down, we moved into planning and action planning what some of those ideas might look like. And I will hand it over to Caleb, who will talk a little bit about, once we had the ideas, how we selected them and refined them.
Thanks, Laura. So once we generated these ideas, we went through kind of a long refinement process, looking at how well these solutions fit with our goals for the project and our values, and how feasible it is to put these into practice. So when we're looking at fit, we were looking at several different factors. We wanted these solutions to involve co-leadership between community and research and everybody involved in these different systems. We wanted these solutions to really address the root causes that Gwen and Michael have shared. And we want to see a high positive impact based on these strategies, which have measurable outcomes. So we're able to see the impact that they're having. When we looked at feasibility, we're considering what's the interest in these projects. Can we envision community partners and researchers involved? We're looking at sustainability, so knowing that a project can be sustained beyond just one project of funding. And then also looking at that funding factor, that we can identify communities and organizations that would be involved in putting these into practice. So we look at both of these. Oh, can you go back for 1 second? Thank you. So we're looking at, this is a simplified matrix that we were using for fit and feasibility. So we're looking for things that are both high on the fit and feasibility axis. And if they were lower on one or the other, we needed to go back and refine and see where we were kind of missing those pieces. So we're going to shift into sharing many different solutions. We have 4 different goals with a lot of different pieces for how we achieve them. We're going to go through all of them at first, one after the other, and then we'll take a pause, kind of reflect at the big picture, and then we'll spend some time looking at those individual goals and how we get there. And we'd love to hear your feedback as we go through this. So I will pass it over to Shannon.
Okay, so goal number 1, the idea is to 3 parts: improve awareness of the community, as well as awareness among the providers of what kind of screening that could be done. The second part is to identify the barriers. What are the barriers to healthcare? And then improve cancer screenings. And so there were 3 ways we considered doing this. The first one is to integrate organ inventories. Now, what are organ inventories? That is a part of the chart where there are a list of bodily organs, and the provider will check off what organs that they know that the patient has. That way, when you're screening, you know what kind of screening, because we do screening based on the organs. So you know what organ a patient has. The second part was to conduct interviews with community members to identify barriers. Transgender, non-binary community members, to see what kind of barriers are they facing when they are trying to receive healthcare. And then the third part would be to develop and test interventions to address those barriers, as well as to raise awareness among the providers and the patients, and so develop it and then test those interventions to see how successful they are. I'll pass it to the next person.
So our second goal we're looking at is around advancing and developing research studies through ongoing collaboration to improve outcomes. In a lot of our listening sessions, one of the big takeaways was that we just don't have enough research. We don't have enough data about cancer disparities in trans communities. That's something we heard from providers and researchers and from community members, not having necessarily standards of care, knowing what kind of screenings they needed. So we're hoping to accomplish this through these different strategies. One is creating an accessible annual event with community and academic co-leads. So we're looking at really building that partnership and focusing not just on trans community having a voice in this research, which is really important, but also tapping into trans folks who are involved in research and academics and have this background that can bring really valuable knowledge. And with an event like this, having something stable and ongoing in our communities that we can see year after year, bringing in that new knowledge is really critical. Like I said before, fostering that continued community and academic partnerships, and then evaluating the impact of the interventions and studies. So making sure we're seeing ways that this is having a positive impact. Is this research improving cancer screenings, outcomes for cancer treatment, relationships between community and providers? So that's our second goal. And we'll pass it over to Melinda and Toby, I believe.
Okay, so our third goal was about a program that currently exists here at the Medical College of Wisconsin that brings people from community, but also academia to work together over a 9-month curriculum to better understand cancer, why we see different outcomes in different groups of people who are diagnosed with cancer, but then perhaps most importantly, to learn how to collaborate, develop not only research ideas, but community action ideas to implement in a sustainable way and to be able to continue to foster new networks and ongoing partnerships, not unlike what Caleb was talking about in the last goal. So the idea would be to expand this curriculum to develop and implement content and discussions which include cancer disparities in the trans non-binary population, and then to pilot and evaluate curriculum changes, again, using that approach that both Toby and Laura had talked about, rooted in those core values of deep equity, biology to policy, and I always forget the third.
Systems thinking.
Systems thinking. Thank you. And now we're going to go to goal 4 with Chris and Andy.
Hi. So with goal 4, we look to co-develop, pardon me, I'm so sorry. With goal 4, we look to co-develop tools that provide trans and non-binary patients, providers, and caregivers with accurate cancer information. In doing so, we'll establish a community and research council to guide and inform cancer-focused trans and non-binary research. We'll inform standard of care and advancement of best practices. We're going to co-develop training modules for providers of trans and non-binary patients. Co-create and leverage mobile apps and online platforms with decision-making support tools, because it's one of the quickest and most effective ways of disseminating information within communities in this digital age. So we're really going to want to use social media and other digital platforms to reach and engage with trans and non-binary communities. And finally, we'll co-develop cancer-focused telehealth services so that we can reach even more people.
Well, I want to thank everybody for coming here today and offering all of your comments. This has been really fantastic. There were so many great ideas. I also want to note that we are funded through the Patient-Centered Outcomes Research Institute through a Eugene Washington PCORI Engagement Award. Chandler also has received receive support from NCI through KO8, but there are no conflicts of interest or commercial disclosures to report. And I think Chandler, this is you.
Yeah, just wanted to say thank you for everyone for joining us this evening, and a huge thanks to our transdisciplinary team who's been working on a lot of these efforts for about a year and a half, 2 years now. It's been quite some time. So thank you guys all for your input. We really appreciate it. And we hope to move a lot of this work forward over the next several years.